Hi guys, it's Dr. Garvey, and in this video we're going to be talking about food sensitivity testing. Food intolerance testing is a super important test, and in my opinion is very underutilized in the healthcare space. In this video I'm going to explain why it's so important to be tested and who could benefit the most from being tested. But before we get into it, a quick background on me. My name is Dr. Christine Garvey, and I've been practicing for 25 years at this point. I have the Allergy Breakthrough Center for the last 20 years, and I've helped thousands of patients get healthy from a functional standpoint. But we use food testing as essentially pillar number one. We have to get the foods right. There's so many people out there with food confusion, me included. That's why I got into this space. In the world of weight loss and weight loss resistance, which is a infobesity epidemic right now, where there's so much coming at you. You know, you got keto, you got paleo, you got plant-based, low carb, sugar-free, dairy-free, gluten-free. What do? You know, you've got food confusion. Getting food tested breaks through that confusion and provides clarity for you. It's objective. You know, we use third-party labs and do the analysis. It's black and white. It's yes or no. It's like, get rid of this food for 3 months, get rid of this food for 6 months. Here's my acceptable food list based on how my immune system is reacting to food. So tying into that, 3 main reasons why we test. You might want to grab a notebook. But really, truly, these are so important. Number one, it takes the pressure off your gut. It takes that stress off your gut. People's guts are a mess. And we know that most disease and dysfunction starts in your gut. So if you have constipation, diarrhea, acid reflux, gas, bloating, you know, you eat something, you're like, oh my gosh, what the heck was it? Was it the dairy? Was it the eggs? Was it the gluten? Was it the soy sauce? Was it something else I wasn't aware of? Remember, you can react 72 hours to something that you ate previously. You know, it's a mess, but what that does, it takes the stress off your gut. That's why it's number one. Number two is that it takes the stress off the immune system. Ultimately, when we test, we're looking at the immune system to determine exactly how your immune system is responding and reacting. You know, we have over 50 million Americans with an autoimmune condition. 50 million. That's 1 in 6 people with an autoimmune. Lupus, MS, rheumatoid, celiac, Crohn's, Hashimoto's. There's roughly about 140 labels of autoimmune conditions, and it's because our guts are a mess. We keep eating the wrong foods that our immune system does not like. Eventually, our immune system turns on itself, starts attacking our own tissues. These are where the autoimmune comes in. It might attack thyroid. There's Hashimoto's. It might attack the nervous system. That's called MS. You know, that's reason number 2. We have to take the stress off the immune system. Reason number 3 is that it reduces inflammation. But by eating the wrong foods, it drives inflammation. So, you know, when we look at these hidden food allergies, they're, you know, creating inflammation, making you fat sometimes. That was the old school thinking, but it's these intolerances that lead to inflammation. So, you know, people with food sensitivities have huge spikes in inflammation in their bodies. We know that a lot of disease and dysfunction has an inflammatory root where inflammation is the driving factor, like heart disease and cancer and diabetes and stroke and Alzheimer's. They all have an underlying inflammatory root cause. And when we know what that inflammation is and knowing that inflammation is driven by eating the wrong foods, right? That's why we test. So who could benefit? You know, people with weight loss resistance, of course, people that are stalled or plateaued, that's, you know, essential. But people with, you know, gut dysfunction, brain fog, anxiety, depression, you're mentally cloudy, you're forgetful, right? You're saying, hey Siri, where are you all day? You can't find your keys, you're forgetting important things, you know, where's this, where's that? You're not mentally as sharp as you once were, right? And so many other things, rashes, all kinds of issues. But, you know, if your guts is a mess, it is connected to your brain. That gut-brain axis is real. That's why leaky gut and leaky brain is a thing. You know, ADHD, kids again and again, you know, anxiety, depression, brain fog. We have to look at the gut. Skin problems, eczema, psoriasis, rashes, acne. You know, there's a food component most of the time. You know, you have to address the chronic aches and pains of the joint pains. You know, you may have these different itises, but remember, bursitis, tendonitis, arthritis, plantar fasciitis, gastritis is your stomach. You know, you've been diagnosed with any form of itis, it's inflammation. So we have to address foods and we have to reduce that inflammation. Do you have an autoimmune condition? Food testing is step one. Again, very underutilized, very not even looked at it when you're going to a medical doctor for that. Let's look at at things objectively. Let's look at the foods you should be eating. Let's look at that black and white test. So if you're checking the boxes with these types of symptoms, and we have more symptoms than we could even talk about, but the most common ones are what we're addressing, right? You should just take the next step, click the button. Let's set some time to have a discovery call, make sure it makes sense for both of us. Have a one-on-one discovery call. It's not some pressure sales call. It's just simply a chance for each other to ask each other questions. I'll ask you questions. You ask me questions, we'll see, if moving forward would it be prudent to be working together to get you a path to get you healthy, but keep in mind, it'll be either me or one of my health coaches that'll be calling you. I have a big team, but pick a time slot below, grab one, and whatever makes sense for you, and we'll have a chance to talk, and help you get you on a nice, healthy roadmap. It's easy. Once we figure out what those things are that are triggering our inflammation, it's really easy. It's just testing and not guessing. And then we'll have a great path, a nice roadmap. It makes it simple. You start seeing results quickly, and we're not leading to more and more and more health issues that come down the road. And that's why I'm New Jersey's #1 kids doc. This is what we do. If we get the kids early and we get people early, we're not dealing with decades of inflammation and sometimes major repair that has to be done. We're more in preventative mode still and can reduce things and get things back to normal or finally normal quickly and very safely. These things are easy. It's just, hey, don't eat this and eat that. We look at all those things. We look at leaky gut. We look at the gut dysfunction. We look at the foods, right? Sensitivities, deficiencies, toxicities. They all go hand in hand. Is there something there that's provoking these? That's what we find out. That's what we do with functional medicine root cause. That's what I do. That's how I approach almost everything. So please grab a time slot below. I'd love to be able to help in any way I can. And thanks for watching. Have a great one.